When it comes to surgery, there are always risks involved.
And today, we're talking about surgical closed incision management therapy that can help improve the outcomes for high-risk patients, including high-risk orthopedic patients, and advance the standard in care in this field.
So joining us today is Dr. John Cooper. He's an orthopedic surgeon at Columbia University Irving Medical Center. Dr. Cooper, by the way, is a paid consultant for 3M.
Thank you so much for being here, sir.
Good morning. Good morning.
Absolutely.
Good morning, doctor. Let's just talk first about surgery in general. There can be complications during and after, correct?
Correct. Any surgery carries with it some degree of risk of a postoperative complication. The most common things that happen in any surgery can be bleeding, risk of blood clots afterward. But one thing that we all worry about as surgeons is the risk of a delayed wound healing complication that can lead to a surgical site infection.
And describe what is a high-risk patient. I mean, tell us what happens to these patients doing surgery.
Thankfully, Montel, the risks of a surgical site infection are quite low with most surgeries, but there are patients that we all recognize who might be at an elevated risk of a surgical site complication or a surgical site infection. And the patients that are at that elevated risk are those who carry certain risk factors like obesity, like diabetes, people who may smoke, and particularly those who have an immunosuppressive condition where their immune system isn't functioning quite as well because of a medication that they may take or because they may have a certain medical condition.
And doctor, if somebody's a high-risk patient, how do you help them reduce that risk besides telling them stop smoking?
Exactly. That's a great point. The most important thing that we can do as surgeons is to work with patients on preoperative optimization, meaning changing anything that we can leading into surgery that may reduce that elevated risk down to a more normal level.
Now let's talk about something that you use in surgery that also helps reduce this risk.
Even with preoperative optimization, where we try to reduce that risk heading into surgery, there are still patients who remain at an elevated risk. So there are certain things that we do as surgeons that can help reduce that risk further in these high-risk patients. One thing that I've been using since 2014 is this device, Prevena Therapy. It's a closed incision negative pressure therapy device, which is the first device approved by the FDA at reducing the risk of superficial surgical site infection in high-risk patients.
Now, wait, how does this device work?
Right, so this is a disposable, single-use negative pressure therapy device. It's intended to be applied up to 7 days after surgery. I put it on in the operating room after I finish closing the incision, and it applies negative pressure to that incision. It helps to hold the edges together, and it helps to remove any fluid or exudate that may come out of the incision or any infectious materials to help reduce that risk further. It's something that we've studied at our center and across the country with other centers and have written a number of publications about it.
Walk me through in terms of what we're looking at here, doctor, if you don't mind.
Right, so there are 2 sizes available here. There's a third size available of what we call a peel-in-place device, which simply means we unpeel the backing and stick it right on top of the closed incision.
Okay.
And there's a more customizable form for more complex shaped incisions. Any of these can hook to this source of negative pressure, which has a canister that can hold any fluid or exudate that may come out of the incision.
Doctor, you had mentioned 7 days. How long is the therapy actually applied?
It's applied for a minimum of 2 days, up to 7 days. A patient can certainly do their normal daily activities with this in place, and they can take a light shower as long as the device is disconnected from the power source.
That's fantastic.
Any final thoughts?
This is a prescription-only product, so if a patient is interested in it, they should certainly consult with their surgeon.
Okay, and I mean, like, I know our viewers are going to be really interested in this because a lot of them may have some pre-scheduled surgeries coming up.
Absolutely.
Where do they go to get more information?
I would recommend going to the Prevena for Patients website.
Fantastic.
Great. Thank you so much for
doctor.
being here.
Appreciate
very
your
much.
time.
Absolutely.
And if you'd like more information, you can go to our website, thebalancingact.com.
And of course, we'll be back right after this.